For this week's Health Check, I'm joined by Dr. Yasu Harasaki from WVU Medicine Camden Clark Medical Center to learn more about neurosurgery. Dr. Harasaki, thank you so much for joining me here.
Thank you for having me, Andrew.
Of course. Now, the first question I want to ask you, I think this one will be maybe not simple, but an easier one for you to answer than for me. What is neurosurgery?
So neurosurgery is an area of surgery that deals with the brain, central nervous system, and nerves. So any disease or conditions that can be treated surgically involving those areas are treated by neurosurgeons.
So what are some of the symptoms? I know you are specifically in the spinal portion of this field. So can you just talk about what you might be suffering from that, brings you into the doctor and you need to have surgery for it?
Sure. I have extra training in spine surgery, but I do treat other conditions in neurosurgery as well. But specific to the spine, most of the symptoms have to do with the nerves or the spinal cord not working properly. So most of the patients I see will come to me saying that for some time they've had numbness in the hands or weakness in the arms or balance problems and such. And there are other conditions that could cause these, but a lot of times it turns out to be a problem with the spine and pinching of the nerves and such that cause these. Now, in terms of other problems that we treat, there are problems of peripheral nerves such as carpal tunnel syndrome and ulnar nerve compression, which a lot of people have heard of. And of course, there are some problems of the brain, and those can present in a various number of ways.
Okay, and so as a neurosurgeon, I know obviously you're more focused on the spinal area and the back, but what kind of surgeries do neurosurgeons do just more in general?
So there are several different subcategories. So one is tumor surgery, and that can involve tumor of the brain or any metastatic tumors in the spine, etc. There are neurovascular surgeries, which involve treatment of blood vessel conditions such as aneurysms. There's pediatric neurosurgery, which deals with neurologic problems in children. There's peripheral nerve, again, involving things like carpal tunnel, but much more involved surgeries that involve elaborate networks of nerves in the shoulders and in the pelvis as well. And of course, surgeries that involve the skull base, which is parts of the skull anatomy that are actually quite difficult to get to, and those are usually very extensively trained subspecialists who do those surgeries. And of course, spine, which is my area of specialty.
Okay, and so what are some of the newest, procedures and latest advancements in this field?
Well, one of the reasons I got into neurosurgery was that it's still an evolving field, and I found the new technology and the new research coming out in the field to be very exciting, and that continues to be the case. In the past 10 years, some of the biggest advances have been made in areas like deep brain stimulation and what we call neuromodulation more generally. So this involves either using electricity or some procedures to change the cells in certain areas of the brain to change activity of the brain. The most common way we use this is to treat things like tremor and Parkinson's disease.
Okay.
And another area is in vascular surgery. So, even when I was starting training, there was quite a bit of open surgeries being done for aneurysms, and that has gotten to be much less now. A lot of these treatments can be done through catheters that get put in through the arteries, and it's a much less invasive procedure and have very good outcomes. And in my area of spine, we've pivoted toward a lot of minimally invasive procedures where we try to do the same surgery with less damage to the muscles and the other tissues. So those are the main things, and especially here at WVU, we're very fortunate to have the RNI, the Rockefeller Neurosciences Institute, where a lot of the really cutting-edge research is being done. And they're working on things like breaking down what's called the blood-brain barrier using ultrasound, which allows us to deliver medications to parts of the brain that are usually hard to access just from delivering medications in the blood by itself.
Right.
And there's some work being done on addiction treatment using deep brain stimulation. So there's a lot of exciting work coming out of there.
Absolutely. Well, Dr. Hirosaki, thank you so much for sitting down with me and sharing all of your wealth of knowledge on this topic.
My pleasure, Andrew. Thank you.
Of course.